Hi there, I'm Tim Irvine.
And I'm Stacy Irvine. Welcome to the Totum Wellness Podcast.
Today's episode, we're here with Dr. Jason Smith, which we're really excited to have you here, a friend of Totum's and ours for quite a while now. And, Jason, I know that you played hockey. That took you to Princeton University where you did your undergrad. You went to the University of Calgary to do your medical degree, over to McGill to do your orthopedic surgery residency, and then a fellowship with Dr. James Andrews down in Alabama, which may not mean much to people hearing that name, but I kind of liken it to if I was a computer programmer and I got Bill Gates to help me with programming, that's sort of the level that we're talking about.
Exactly. There was these few godfathers of sports orthopedic surgery, and I got to work with one of the godfathers for sure.
Which is incredible.
Yeah, it was great.
Really cool. And currently, you're orthopedic surgeon at OV Surgical Center, at Scarborough Centenary doing orthopedic surgery, consulting physician with the Jays, Toronto Blue Jays, the head physician with Baseball Canada, and now also with Golf Canada as a consultant or?
Consultant.
Okay. Which, you're obviously in the athletic world. You come from a professional athletic background. I know you were drafted by the Calgary Flames and played in their system. Tell us a little bit about sort of that journey and getting into orthopedic surgery and the difference between those two sides of it that you're involved in now.
Medicine was plan B, right? When you're growing up, you're going to be a hockey player. When you're growing up, had an opportunity, presented itself to go to Princeton University, go down to the States. Thankfully, a little bit of nudging from my parents that maybe that's the better option than going to the Canadian Hockey League. Maybe not, but it's your choice, nudge, nudge. And I'm fortunate that I did because I had a good career at Princeton and I got drafted by Calgary and I kept the dream alive. I got to turn pro. I got to go to the Calgary Flames training camp. I got to sign with them. But
it's a big deal.
It's
a really big deal.
It was a dream come true. I was on track. I was making it. I had signed an NHL contract and here we are. It's go time. But that year, injury, right? 3 concussions that year. And suddenly your dream of being a professional hockey player, thank God I had a plan B. Thank God I had a Princeton University degree under my belt. When I went to Calgary, met with the neurosurgeon there, he's like, we don't know about these concussions yet. We had just started all that neurocog testing, all that stuff. He goes, I don't know. Maybe you can have 1 or 2 and you're fine in your life. Maybe you can have 20. We don't know yet. You have a Princeton degree, go use it. And
that's great advice, really.
Making that shift wasn't really hard because I had a plan B. I had a degree. So I'm so lucky that I did. And then, from there, we always talk about medicine kind of chooses you once you enter it. You're thinking, I'm going to be a pediatric neurologist. I'm going to be da-da-da-da-da. But you find yourself hanging around with people with kind of like interests, patients that you can relate to, and suddenly you find yourself excelling in sports medicine because, hey, you can relate to the patients, you know what they're going through, and then orthopedics and sports orthopedics. So that journey just kind of took itself with my experience playing hockey. So it all kind of came together in the end so that now I'm still in a locker room. I got to be down at Rogers Center, 30, 40 games a year, still hanging out with players, still hanging out with athletes in my office. I'm just on the other side of it. So the journey has been really interesting and I'm very fortunate.
I think too, people don't maybe understand too the amount of work. You describe it now and you describe it as being easy. But first of all, we have our youngest is in the GAAA system. We know very well how hard it is to get out of that and then to get to a place like Princeton. That is a huge challenge. You have to have good marks. So you have to be working at school and at hockey, which is not always the easiest thing. And I think that that's an amazing accomplishment. And then to go and get into med school, not easy. and to be able to go to the level that you're at. I'm wondering, can you talk a little bit more about Florida? I've heard rumors that they fly on private jets to things. It's a very different system from what we have here. Can you describe that a little bit more?
Yeah, Alabama.
Or sorry, Alabama, right?
So James Andrews, sports orthopedic surgeon to everybody, to the stars. One thing you notice is that people are flying in from everywhere. So come your Monday clinic after Sunday football, like it's concierge service from the airport. Like we had our own drivers because all the football players would be driving in, limos would be picking them up, and we'd be seeing all the football players on Monday, operating on them on Tuesday. They'd all stay the week, and then drivers back to wherever they would go. That was our Monday. But on Sunday, we covered the Washington Redskins from Alabama. So it was drive your car to the private jet, get on the plane with James Andrews, fly to wherever the Redskins are playing. You're playing in Dallas, or you're playing up in New York, or wherever you're playing, cover the game, get back on the plane, fly back to Alabama, and get up and either operate or clinic that Monday. It was mostly Monday clinic. But yeah, it was wild.
Incredible.
It was crazy.
That is incredible.
He was running 4 ORs simultaneously. We had a fellow in each room. We were doing 20, 30 cases a day. It was just,
Wow.
it was absolutely incredible.
That's an incredible learning experience. I can't even imagine.
Volume is key.
Yeah.
So you got to see a little bit of everything. Like you'd have to do 4 fellowships here in Canada to get the experience of one of those fellowships. So
And
it was
especially with
amazing.
the athletes, if that's
Yeah.
what you wanted to specialize in, we just don't have that volume of athletes going through the surgical system like down there. That's amazing.
Yeah, it was really,
That is
really
very
cool.
cool.
Very fortunate. It was
So then
fun.
you transfer to here.
Yeah.
And how does that go? What does it look like?
It's back to The Godfather, the transition. Like, well, how do you end up? Like, I'm from Calgary, no family in Ontario. How do you end up in Ontario? And it's literally walking to lunch one day and walking with James Andrews, and Alan Gross from the Toronto Blue Jays calls James Andrews and goes, we got this injury, we got this going on, da, 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 da. And oh man, we're losing one of our orthopedic surgeons. She's going to Dallas. So, we're short one guy up here. And it's literally James Andrews going, well, Alan, we got this Canadian down here. He does a heck of a job with that Tommy John. He's doing great in the OR. Y'all love to have him back working with the Toronto Blue Jays if you can have him. And literally the Godfather had spoke. Like Alan Gross is like, yeah, okay. Well, so I talked to him on the phone, and I actually had met him. I had done a clinical rotation with him way back in medical school.
Right.
So I knew him. And he goes to me, Jace, if you can find a hospital in Toronto to work at, we'd love to have you involved with the Toronto Blue Jays. So now I'm sending my resume to every hospital. Like I didn't do any training here. I don't know all the
You
guys.
didn't have a lot of contacts.
I'm literally firing out resumes to every single hospital in Toronto. And the guys from Scarborough were like, we don't have a sports program, but we were thinking about starting one. And to have the Jays association with it, we'd love to have you up. And that's how it all started.
Perfect.
Yeah, pretty crazy.
Well, and also, again, speaking to your talent, because you wouldn't have been recommended if you weren't good and you hadn't put the work in and all that. So I think it's a little bit of, luck, right place at the right time, but you still have to have the skill set.
So take that experience in Scarborough. You're at now with OV Surgical Center. How does that compare between those two systems?
So this is the public versus kind of private models that are now starting more so. So, there's certain fundamental restrictions that you have in the public system. And this is where, as a physician, you always want to give your patients the Toronto Blue Jays experience, and what does that look like? That, and we should probably dig into that a little bit, what that looks like, what a Toronto Blue Jay goes through when he's having their surgery. And you're trying to give that in the public system. So the first barrier you run into is time.
I was going to say,
Time, everything. It's getting surgery at the time you want. That's the best. That sometimes it's right away. Sometimes it's 6 weeks of rehab beforehand, but you get to choose when that surgery is. And then in the world of sports orthopedics, like cutting edge, what is the best, what is the latest and greatest, especially stuff with cartilage rejuvenation, stem cells, all these things that we're doing that's changing so rapidly. It's hard for the public system that we're 22 orthopedic surgeons at the Scarborough Health Network that, okay, I want to use this fancy new thing. Well, try to get it through, try to get it in, try to get it costed in, try to get it built in. So when you finally get it approved and finally get to use it, suddenly you're like, well, that was 2 years ago. I want to use this now.
The next thing.
Is that really how long that like roughly that transition would be?
Depends what it is. So a lot of this stuff we're under contract. Like we sign these 3 to 5 year contracts where you have to use this device
the
or
provider.
this company.
Yeah.
And you're like, but this company came out with this new greatest and latest. Now, the vast majority of things, it doesn't really matter. Like we're using incremental things, but every now and then there's a leap and it kills you to not instantly be able to offer that to your patients. And so that's where you're a lot more nimble in the private system because the cost of it, well, the cost goes back onto the payer. It doesn't come from the hospital budget doesn't have to get it approved. So it makes things a lot easier.
What's an example of one of those leaps in the last recent past?
I would say it's to do with the cartilage rejuvenation, right? It's the stem cell techniques that we're using. Because it's not a simple little, okay, well, is this a suture passer? Or is this a better tape? The hospitals don't even know how to really classify it and go about it. And that's what's really changing. So are you being able to use these collagen matrices with stem cell transplants? And that's where it's really nice to be able to just stay on the cutting edge of those things in the private model.
So in practical reality, one of the Jays has an injury. It's an acute injury. It just happened. But part of your consultation is like, okay, well, this you need surgery. Having this regeneration technique is going to be an important part of it. Like, what actually is that? And so for our listeners who they're not, well, maybe some of the Jays are listening to it. You never know. How does it impact them?
Well, everything is about movement. Everything's about return to play. Everything's about return to life, right? So anything you can do to optimize that. Now, those little tiny incremental things you do in the UR translates to, for a professional athlete, it translates to performance. Like performance metrics down 2-3%. It's the difference between being a minor leaguer and a major leaguer. But then those things are amplified. So as it relates to the general person, those things then are amplified over years and years and years. Like that year that it took you to get to the surgery and then maybe not the top thing. You may not notice it. Your early outcomes are maybe pretty similar, but it's 5 years, it's 10 years down the road that you really start to see these things play out.
What we see at the clinic with some of the things that are going on here, I would say, especially in Toronto, because we live in a very busy place, a very high population, is that the wait times cause a lot of degeneration while they're waiting. And I think sometimes the system can be so you're on an island. So you have the surgeon as one part of it. You have the patient GP as another part of it. We're looking at the movement and trying to get them pain-free. Ultimately, that's our job. Keep them strong, keep them moving, try to deal with the pain that they're having because they're waiting to go into surgery. But because we see them a lot, it could be a couple times a week, what we notice, especially in the older age groups, there's so much degeneration of their quality of life and their general health. And then I'm worried, as their provider, I might have someone in their 60s who is super active, but because they were in a lot of pain while they wait, and let's be honest, it's usually hip, that tends to be one of the most debilitating ones, that they can't go for a walk. There's a lot of stuff they can't do in their daily lives. I see their health deteriorate quickly kind of as they stop being active and moving. And I'm wondering, you must see such a diverse difference between, you've got this athlete, they're getting in the MRI sometimes the night of, right? They get injured, they're slid into the MRI. Surgery, like you said, could be the next day, could be the day after, versus what what we're used to dealing with, it's so different. And how do you even
Yeah.
deal with that?
Like it's such a crazy concept, right? Like imagine what would happen if I put your leg in a cast for 6 months. Would you ever get it back? Like it's hard to build muscle when you're 25 and have a team of therapists around you and your own dietitian and the latest and greatest. Like these guys, it's still hard to build muscle. Now be 50, be 60 and try to build muscle. Like it's really, really hard. I'm speaking to the experts on that, right? But then lose it and try to build it. Like it's almost like you can never get it back. Like you once you've lost it past a certain time, you're up against the wall. So the key is to not lose it. So, from that point of injury, you got to be working so hard up to surgery. And that's lost on a lot of people. And you guys do an amazing job. I love seeing your patients because they come prehabbed. That prehab component to it is so key. So that they haven't been in a cast for 6 months. They've been working on these things. Now, if a tendon's not connected and the muscle's not working, I mean, that atrophy's happened and then you're working double on that. But at least everything else around the
Right.
person also hasn't been in a cast for
Yeah.
6 months. So that every other muscle that you're working on is ready to go. The second you're out of the surgery, you're not having to wake everything else up. So it's so key and it's such a difference. Patients that have access and do their prehab, because the reality is there's a wait time and there's going to be a wait time. But if you've prehabbed, you hit the ground running after your surgery.
When it feels to me, you can speak more specifically to this, but the public system, like in a hospital, you get your surgery, and then you go to within the hospital, you get maybe 3 weeks of attention, and then you're gone. I don't even know
You
what
get
it is.
no attention, right?
Even
And
worse.
so that's the reality of the public system. Outside of like some of the hip and knee protocols, where it's all bundled funding, where you get some of it, but tear your rotator cuff or you have a quad injury. I mean, there's no outside of a little bit of OHIP if you're over 65. As you guys know, there's no funding for this. Like you're on your own.
Well, and what happens with people that we see is, okay, you get out of pain. So if you've had the surgery and you do the work to get out of pain, so now you're back to quote unquote normal function. But the surgery was on your right leg. Now you've atrophied. You now become out of pain, but now you've got this huge imbalance that actually doesn't show up for a number of years. And that's where when I talk to clients about their hip replacement, knee replacement, whatever it might be, I say, okay, you're going to get out of pain, and then you've got another 9 months to go, right? So you have to do the
Build
full
back up.
year of treating it like it's an injury to get as close to back to where you were as possible.
It's amazing how knee bone's connected to the hip bone, connected to the shoulder bone, connected to the, you take one joint and immobilize it, change it, something. They have shoulder pain. It's amazing how it's all connected. And I see that so often that, once they've had the one surgery and if they didn't get back on it, suddenly they're your shoulder patient. Now they're my knee patient. Now they're my whatever. But if you can get on everything, it's the getting back to normal. One is understanding what your normal was before. So having been a part of a gym, a health facility where you know what your baseline is. Because with the Toronto Blue Jays, like we've done preseason physicals, we've done all the metrics. We know what their single leg force plate testing shows and everything like that. So we know what their normal is. So if an individual is already a part of something like this, that you know what their normal is, it makes it so much easier to get back to it. So it's concept of prehab, but even before you're injured, just a part of having a sports team around you to keep moving. You're already being treated like a professional athlete.
And you've been in the athletics basically your whole life. So, and at Totum, Stacy and I come from this, I played football at university, Stacy was a heptathlete. So this idea of circle of care, right? So you want to be the best athlete that you can be, and you've got an athletic therapist, a physiotherapist, a massage therapist, nutrition, strength and conditioning, et cetera, all around. That really makes a big difference in how well you can perform. And so what we try to do, and I think that with your general population people, is, to your credit, I think you take way more time and interest in the full picture for that person compared to a lot of surgeons who are like, "Yeah, went well. See you.
Yeah,
Don't,
they hardly
don't need to
follow
see
up
you again."
because we've worked with other surgeons as well that didn't have, and we don't ever blame them because a patient will come to me and say, I hardly spoke to him. I don't remember speaking to him. They're painkillers and the whole thing. And I say, look, they're on to the fourth, fifth, sixth surgery of their day. I know they checked in on you, like we've got it from here. Don't panic, but like we get it.
But I mean, Andrew's always said, like, when we're leaving our fellowship, he kind of gives these like gospels that you need to do. And he's like, if you want to have success, you got to hook yourself up with a good therapist. Like, you are not going to have success as a sports orthopedic surgeon if you don't work with a good therapist. So I've taken that model. Like, I've always hired a therapist out of my own pocket, and the government doesn't pay for it. But it just having a therapist working side by side with me in the clinic, just to help keep an eye on things and help orchestrate, that's made such a huge difference to my practice.
It's so crucial. I also think that when people are talking right around their surgery, when you talk to them before, they're probably very nervous. So it goes in one ear and out the other. And then I've had patients show up where they don't remember any of their conversation, any of the instructions, which is fine because they're with us. And again, we can help them with all that. But I'm kind of amazed that they can't remember. And you can see where that would be a huge difference between a professional athlete, because a professional athlete would have someone with them constantly. The surgeon would be very
so
focused on them.
overwhelming when you tell somebody that you need surgery, just like
Emotionally, even.
it's crazy. So I always tell people, listen, you don't need to ask all the questions right now.
Yeah.
You don't need to be ready. I'm going to bring you back, 3 or 4 weeks before your surgery. You're going to come back in. You're going to sit down. You're going to meet with my athletic therapist. You're going to meet with me again. You meet with my secretary. You meet with everybody, and the whole team will get you on board. In the meantime, here's your prehab. And then you guys you've seen it. You've rehabbed with everybody. So when they come in the next time, they're aware of their exercises already. They already know about the surgery. They know about the rehab. You don't hardly even tell them, oh yeah, Tim and Stacy have told me it's going to take 6 months and this is what I should expect. And it makes the process actually progress, because it's crazy. You need surgery, book it. You don't have another conversation, do your surgery, and then talk to you when your pain medication's on board. There's no chance. You have no chance.
Well, it can be so different, and that's what we've learned. You've been through the surgery. I've been through various other surgeries, 3 C-sections, things like that. And I'm always amazed at, there's really fundamental things that are missing in our system that could change it dramatically for the better, and they're not expensive. Nutrition. What are you doing leading up to your surgery? What's your care like immediately after? Did you get the Game Ready device? Are you using it? Those things can make such a huge difference. How are you going to sleep? Do you have 2 toddlers at home that are, does your partner know that they're not supposed to be crawling all over you, like when you are just out from the OR kind of thing?
On this note, what are 3 things at random that you think are really important that people might not think about that they should consider to have a successful surgery?
So we've touched on it. The prehab is absolutely pivotal. Like, it's maybe the most important thing.
And that's strengthening and mobility as best you can.
So that you know how to do your exercises before you try to do them post-surgical where everything's all messed up. Like, you should know how to do your exercises.
Yeah, that's such a good point.
I bring somebody back for their first week follow-up, and they're like, okay, so what have you done so far? And they don't even know how to move. It's crazy. The second thing I would say is the nutrition around surgery, and that's micro and macronutrition. You're building muscle, you're building tissue after this. Like, you can't be catabolic. Like, don't be trying to lose weight around this, because, your body's going to steal it from somewhere. You're going to go into this crazy healing state where your body needs amino acids, it needs proteins, and it's going to steal it from somewhere. So you're going to steal it from elsewhere. You're going to steal it from your organs. You're going to steal it from these places so you can't be catabolic. You have to be calorie positive, and you have to monitor that. And you have to look at your protein intake. You have to look at your micro and macronutrients. And there's some great companies now that are helping support us, through surgery, what that is. But that's imperative. And the third thing we talked about is just all the lifestyle, the sleep. Like, what is your support? Like, you can't be trying to, and it's unfortunate, people that can't take time off of work afterwards, that they're trying to recover from this, then still work, and they're getting, poor sleep. But, growth hormones secreted while you sleep. This is the main restorative. So to talk about surgery without talking about prehab, nutrition, or sleep, you're way behind the 8 ball to begin with, because those are the conversations that are had with the Toronto Blue Jays. Like, they meet with their dietitian who sets up their surgical 5 days before, 6 weeks after, changing micro and macronutrients throughout it. Like, they have a PhD dietitian that's following them. And you see the difference in that. And they're monitoring their sleep. They know what their heart rate variability is. They know how many hours of sleep they're getting. And they know how important that is when they're secreting growth factor for healing. So they're monitoring all these things, and you really see the difference.
It's such a good, important conversation to have, because we're always talking about sleep and nutrition and all these things. But when you think about it from a healing perspective, it is the most crucial thing, in my opinion, that we always say it's the baseline. If you don't have sleep, nothing's happening anywhere. You also talked about a while back, we were looking at some of the products that you have that are nutritional support for pre-surgery. Are those post-surgery as well?
Yeah, so the one I use is actually a great company. It's called Proven, out of Toronto, and it was Sagar Desai, who's a great foot and ankle sports surgeon out of Humber, with his team of dietitians and nutritionists and scientists, kind of came up with what is the key micro macronutrients that you need for the 5 days before and for the immediate post-op. Because there's great research
easy
that,
for
like,
people too.
a simple amino acid like arginine was shown to decrease infection rate. But am I going to tell a patient, okay, go get some arginine, get some vitamin C, make sure you get some magnesium,
and take them in these quantities,
and also make sure you have the app that you're taking this much protein and all. Like, forget it.
Yeah.
Take a scoop of this twice a day, 5 days before, 5 days after. So,
amazing.
We have these pioneers that are really helping us.
I love that.
Navigate these things. So,
I love that.
So I have the dietitians, I have you guys, I have the therapists around it. So, without the tribe,
it makes a huge difference.
Huge.
I noticed from my surgeries coming out, there were a couple things. Well, first of all, I used ice. It was a C-section, but I made sure to rest. Tim can attest to this. Is like, I was like, okay, you're not at work. You've got the kids, because we had toddlers at home for the third one. And I would ice, and then I'd go walk laps around the house, because that's all I was kind of allowed to do. And then nutrition, I was doing smoothies. I was doing all the right things for that. This was many years ago, where we didn't have these types of products, but I was able to do it myself because of what we do. And I also was using support. Because with the incision, I found that I just use a simple tensor bandage. And as soon as I had it on, I could do way more than when I didn't have it on. I remember going back, you have to go to these follow-up. I remember saying to the nurses, I said, a tensor bandage costs $2. And it was a game changer for me. And why don't you tell women that they could use a tensor, they could eat well, and that they could move a bit and use some ice a bit to help, deal with some of the incision and inflammation. It's incredible that it's not out there.
It's incredible, but that's why it's so important to have your allied health.
Yeah,
for anything. Because put that more on the nurses that are doing a million things, and more on the doctor that's just trying to get through.
Yeah.
That's why it's so important that around your surgery, you can have this health team that's helping you to give you those clinical pearls, to tell you these little things that, unfortunately, they don't have time.
It's
our system is like, time is gold. So we're trying to get the surgery and the base done. Everything else, you're on your own.
Yeah. But, and conversations like this are great because then we're letting people know what you could set yourself up for. Because even now with Whoop bands and Aura rings, you could be kind of tracking what is your sleep like? What's the quality like? Okay, you have your surgery and then trying to get back to those good nights of sleep. I think there are devices out there that could do it. And I think that that's great because that's accessible to lots of people. I also am very interested. We spoke with your partner, Jazz, a while back, and he had just been in Italy and he was looking at this ACL, I believe it was ACL rehab. And let's talk about best of, like what's happening out there. That's kind of the stuff that he was telling me was kind of blowing my mind that they were doing 2 a day at least rehab right after. You can speak to it
Yeah,
better than
no,
me.
Dr. Shahal, yeah, he was out there looking at, because these pro soccer players, they're like talking 4 months, 5 months. Like,
It's incredible.
think about what a month means to the budget of
Yes.
a sports team, right? The guy's making $20 million, right? So season 6 months, loses a month of that. That's costing the team $3 million of like player asset application.
And you got to put somebody else in place.
So
too.
if you can get a guy back a month earlier, like the money saving that you get from that, I mean, it's absolutely huge. So this is where we're learning from that we can apply. So it's therapy right away. So they're actually, and this is where it becomes hard in our public healthcare system. ACLs, again, stay in hospital overnight. Keep your knee moving all night. Keep a drain in the knee to get all of the blood out of it. So like everything is about day surgery, get the patient in, get them out. And they're like, no, wait, you're better. We can manage your pain overnight. We can get all the blood out of your joint. You can be on a passive motion machine all night and you get your first physiotherapy appointment in the morning. So already you're ahead of the game. And then it's everything else around it. But these guys, they're spending like 6 hours a day, in these training rooms and stuff. And is that reasonable? I'm not going to do that, but
Nice to fantasize
but
about.
the point is that, if you didn't fall behind and if you come out of the gates right away, like you're 80% there, and then you're doing your exercises on your own at home every day. And then you're using the latest and greatest of all the technology for
Right.
all these things. And it's amazing how much of a difference it makes. Again, it's the therapy afterwards. Like
This is the great thing about pro sport, though, is it's pushing the envelope for everybody. So yeah, does everybody have the opportunity to work out or get a 2-a-day rehab session? No, but some people do. And it's just a proving ground for how things should be done that eventually works its way into the public system.
Patients are so appreciative if you give them the chance to do everything like a professional athlete.
Yeah.
Like it's amazing that okay, the icing and the sleep and the nutrition and these gadgets and all this stuff, like people want to do that. They want to make it work. It's when they don't get the guidance for that they're resentful. Well, I saw this guy, he has got a great rehab, he did all this. Nobody told me to do that.
Right.
Like people want to get better. And
of course,
as a sports surgeon, it's your job to offer them all of this amazing stuff so that they can use it. If you don't offer it, they don't know.
How in post-surgical procedures, how important is movement? And I ask that because in our world, just from a rehab perspective, and I've experienced this personally as well, like I hurt my back in the morning, but I've got a day, I've got this meeting, that thing, whatever else, I got to go. And by the end of the day, my back feels markedly better than it did in the morning. And I think what if I just sat around all day because my back is sore? Would it feel this much better? So obviously movement helps to resolve some issues, but in a post-surgical environment, how much movement should somebody have?
Well, it's amazing that we don't immobilize anything anymore, right? It's that movement that's so important to stimulate healing, stimulate blood flow, stimulate the neurology behind it, grow those neural connections. So there's a balance. There is contract something too much and you start to pull it away versus contract it a little bit, you stimulate it to heal. And there's a real balance there. So that's where the very specific rehab protocols, I think I give it 8-page protocol, post rotator cuff surgery, so that, a patient knows when they can move, how much they can move, but it's every day. It's 2 times a day, it's 3 times a day, depending on where they are in the protocol. Movement is key. It solves everything. Like, there's nothing in orthopedics outside of fracture healing that should ever be immobilized.
And would the idea of, okay, you had surgery, think about a bunch of glue that's been squeezed in there, let's say shoulder surgery. If you keep it moving, the glue stays loose and pliable. And if you don't, it starts to harden up. Is that a fair thing for people to think about?
I don't know how you think about that, right? Because there's an element of healing that needs to happen, but too much healing, that's the scar tissue we talk building out. It's almost, you get the super normal response that can work against yourself. That's the art of therapy.
Mm-hmm.
Like,
Yeah.
try to figure that out on your own. Am I doing too much? Am I doing too little? That's the art
Yeah.
of, okay, no, wow, I can feel you getting stiff. Like, I see you at a week, I see you at 6 weeks, 3 months, 4 months. Like, I see you 4 times. Which direction are you going? Do you need to ramp up or ramp down your therapy? That's the art of it. You need a professional with hands-on to gauge that for you. You
Right.
can't expect a patient to know that for themselves.
on top of all the other things in their life.
So I'm curious, your experience in Alabama with James Andrews, your experience with the Jays, and how that's influenced what you're doing at OV.
The biggest thing is being able to use what is the best, right? What is the latest? What is the greatest? What is the best? Without the constraints of one time, and a bit also monetarily. Like, what doesn't necessarily fall in the hospital budget that you can use. So it's so exciting to be able to treat anybody the same way you're treating a professional athlete. The ability to do that, treat people optimally, is what you're trying to do. And to not be in the same constraints of the public system has been really exciting. I've been really happy with the outcomes. And just to get to apply those things that these guys are flying all over the world and getting it. Now we get it here. It's great. It's been a lot of fun.
We would have quite a few clients that would fly to the US for surgeries because they didn't want to wait. And how many of our athletes would get flown down. And so we think it's very exciting that that's all staying up here now to a certain degree.
It's crazy that they fly
For
down.
so many years, we flew people down, and then I had people choose because they said, I can't wait 5 months. And so off to the Mayo Clinic and get their surgery and come back up and do the rehab up here, which now we can do it here, which is so wonderful.
We have the best surgeons. We have access to the best technology. Not like they have any different equipment we have that we don't have up here. We have access to everything. Now we get to use it.
I just spoke on a panel. There's a lot of talk about women in sport now. It's very exciting. We have all these new female professional teams. We're all saying it's about time. And a lot of the conversation has been around the differences between men and women. And specifically, generally, it comes down to hormones. And what we've noticed in our practice is that there's been some really interesting thing with female athletes. The one of the biggest changes is the influence of estrogen. When I was an athlete, I was oleomenarcheic, amenorrheic. And as an athlete, I was told that was totally fine and absolutely normal. Now we have data to prove it is not normal. It is not fine. You will not perform at your best if that is happening because estrogen has such a big impact on your tissues, similar to testosterone in men.
They have such a close interplay.
Exactly.
Right? Testosterone, estrogen in females, absolutely.
Exactly. And so thank goodness we know that now, because when I'm coaching, I'm having these conversations about with the girls about this topic and saying, if you're finding that you are missing all your periods, you have to come talk to us. This is not a healthy thing. And then at the other side of it, which we see a lot in our business, is women going through menopause, but at the same time, they're having hip replacement and they're having joint surgeries that are not healing well for the same reason they don't have estrogen. And I'm wondering if it's a topic that has been brought up in your world.
Yeah, so this is a part of the importance of a team around
Mm-hmm.
you, right?
Mm-hmm.
Using an endocrinologist, using the people, because of those fundamental differences. It's the things that I see mostly are relating around the ability to put on muscle mass,
Mm-hmm.
right? And that's what we fight with more so in the female athletes. And it's that delicate interplay of
Right.
estrogen and testosterone
Yes.
and their growth factors and growth hormones.
Yeah.
That if you've disrupted that,
Yeah.
before you're,
Yeah.
fortunately, it's changed,
Mm-hmm.
right? Girls aren't these skinny,
Yeah.
catabolic,
Yeah.
they're healthy people. But it's a different conversation when you say, listen, you can't be calorie negative, still with
It's hard.
athletes.
It's
And
hard.
like,
Aesthetic
I,
sports.
I
It's
want
hard.
you to put on a little bit of weight
Mhm.
after the surgery. So
Mhm.
because you can't be catabolic around
Yeah.
it. And so those conversations become a little bit different,
That's interesting.
with females and that, but they understand that. And now, the female athletes, they're older now. Before it was the under 18, you hit 18 when you're done. But to see these gymnasts now, performing into their 20s, you
Mhm.
see, and with the professional sports leagues, these women getting to play into their 20s and 30s that
Mhm.
didn't exist because everything was like maybe college won Olympics. But
Yeah.
these professional sports leagues are
Yeah.
allowing us to
It's
look at
awesome.
it and track it. It's been amazing.
It has been amazing having kids. A bunch of the sprinters, women in the 100 and 200 meters, quite a few of them had children, which would be unheard of. There was actually a nursery set up at the Paris Olympics, never been done before, which how cool is that? But it is something that I think we all need to get comfortable with these conversations. And I also think too, more female coaches, we've got one coaching the Kraken right now as well, right on the bench.
Yeah.
And I think that helps these conversations with female athletes that there are females coaching them.
Yeah, for sure. And the head with the professional women's hockey team here in Toronto, was a colleague of mine, or I went to medical school with her. Dr. Wanda Millard is taking it over. So I've been having a lot of great
It's
conversations
fantastic.
with what's happening with her. The big thing, one of the big differences that I see and kind of supported by the data is women don't get these minor injuries as much, but they get these major injuries more. So like the contusions, the hamstring strains, the oblique strain, and stuff, they don't get them as much. They get full on tear. So like their ACL tear rate in soccer versus basketball for females, 2, some studies 5, maybe 10 times higher than males, where the incidence of injuries is so much lower, but the injuries they get are so much worse.
Yeah, I can explain that. They don't complain about the small injuries.
Exactly. Yeah, it's not picked up in the reporting. Absolutely.
Last question for you, and then there's actually one little tiny question, but that'll be really quick. So Shohei Ohtani, World Series, subluxes his shoulder.
Yeah, it
Which-
looks like, again, professional sports is just like, nobody knows. You can't know. So I mean, we're all guessing. Now they have released that it was a subluxation dislocation event that tore the labrum in his shoulder. This isn't any kind of insider information. I'm getting this from the media like you guys are. Yeah.
And so he plays the next day, which how does that happen? Because the guy, subluxation is the head of the humerus, the shoulder ball comes out, goes back in.
Yeah.
And
And torn labrum.
then he plays.
Can't feel good. Explain that to us. What did they do?
As you guys know, to be a professional athlete, like, you've kind of won the genetic lottery a bit.
Right.
Like, as much as we say, you can work at it, you can do it. Once you're there, you're a different set of genetics, right? And also what you've had to tolerate, what you had to go through, your ability to push through pain. These guys are also just wired differently.
True.
Like, it truly is. So tell these guys how to work through pain and how to fight through it. Well, they've kind of been in pain almost every day since they were 14. So it's different. So a guy like Shohei Ohtani, one, he's getting treatment like probably every second up to that point. So it's amazing what we can do if we get on top of inflammation early, right? For controlling pain with the icing, with the modalities, with everything we're doing, with the how much sleep, getting the hyperbaric oxygen, like all these things that he's doing right away. But honestly, it's just suck it up, Otani. And he did.
Oh,
I mean, the guy's a
worth it.
monster.
Worth
It's crazy.
Yeah,
Like
it's remarkable.
not many people, and sometimes we kind of get on baseball players, maybe not being as tough as a hockey player. They are. It's crazy what these guys play through, and what he played through is nothing short of amazing.
Yeah, that's incredible. Jason, thank you very much for joining us. It's been so cool and awesome to hear about what you're involved with and your experiences and how it relates to general population clients like ours, as well as the best athletes in the world.
It's been great working with you guys. Great to talk to you guys today, and it's been great working with you guys. You can really tell when a Totum patient comes for their surgery how they're going to do before and how they're going to do afterwards. So it's been great. You guys have made me look good over the years. It's been a great relationship, and I thank you for that.
Thank you. We're very thankful that you've taken such good care of all of our people. We appreciate it. And our kids.
And kids and husbands and
husbands.
And
husbands. Oh.
Exactly.
All right, thanks for joining us on the Totum Wellness Podcast. Thanks for listening to the Totum Wellness Podcast. Please follow us on Apple, Google, or Spotify and leave a 5-star review and comment. Subscribe to us on our YouTube channel, and please spread the word to family and friends.